Okay, we said this is the intact cerebellum, both cerebellar hemispheres, and in their original position inside the brain. So if we now take one of the cerebellar hemispheres and remove the other one, again, this is the anterior surface of the left cerebellar hemisphere. All right, so we see this is the position of the primary fissure, dividing it into anterior and middle or posterior lobes. This is the position of the transverse fissure, dividing it into superior and inferior halves. This is the flocculus, and this is called the peduncle of the flocculus, the posterior part of it. The flocculus, together with the nodule of the vermis, forms the flocculonodular lobe, which is demarcated by the posterolateral fissure. So this is the posterolateral fissure. Then we said this is the original position. On the inferior aspect, this is the tonsil of the cerebellum. And we also have the cerebellar peduncles again. This is the superior cerebellar peduncle for connection of the cerebellum with the midbrain. This, the lateral, you can say the lateral one is the middle cerebellar peduncle for connection with the pons. And the most inferior is for the inferior cerebellar peduncle for connection with the medulla. This is the vermis, which connects the two cerebellar hemispheres. On the anterior aspect, this is the vermis. On the posterior aspect and inferior, and this is the medial aspect. It is composed of many parts. The most important ones are the first one beginning superiorly is the lingula, and the one below it, the nodule. These are the most important ones. The lingula, this is the lingula. We can see this was the anterior original aspect. So if we go medially, the first superior one is the lingula. Below it is the nodule. Below the nodule, we have the uvula. This is also partly important, the uvula. And below that, we have the pyramid. This is the pyramid. So this was the lingula, the nodule, the uvula, and the pyramid. The other parts are not so important, but we'll just mention them briefly. Behind the lingula is the central lobule. Behind the central lobule is the culmen. This is the culmen. Behind it, there is the declive. Then posteriorly, this is the phallium. On the posterior aspect, you can see it here. This is the phallium. Below the phallium, we have the tuber. This is the tuber. And again, we go back to the pyramid, the uvula, and the nodule. So on the anterior aspect, this is the lingula. This one. Below it, number 8 here, is the nodule.